All right, chapter 9, here we go. Parenteral medications. What is parenteral medication? Well, parenteral drug administration means any non-oral means of administration relating to injection directly into the body bypassing the skin and mucous membranes. The common parenteral routes are intramuscular, which is IM, subcutaneous, which is subcut or subQ, and intravenous, which is IV into the vein. Some advantages of these would be that it can be used for drugs that are poorly absorbed, inactive, or ineffective if given orally. The IV route provides immediate onset of action, like if you're dehydrated. The intramuscular and subcut routes can be used to achieve slow or delayed onset of action. Vaccines. Patient concordance problems can be avoided, which means they'll be less dizzy with the side effects. Disadvantages, staff need additional training and assessment. It can be costly. Aseptic technique is required. That would be the sterilization of the area where the needle is going to be placed. It may require additional equipment, for example, programmable infusion devices, and it can be painful. Parenteral medication supplied as liquid. An ampule is a sealed glass container that holds a single dose of medication. It has a narrowed neck that is designed to snap open. The medication is aspirated into the syringe by gently pulling back on the plunger, which creates a negative pressure and allows the liquid to be pulled into the syringe. A vial is a plastic container that has a rubber membrane on top. The membrane is covered with a lid that maintains the sterility of that membrane until the vial is used for the first time. If it is a multi-dose vial, the lid will be replaced after each use to maintain the sterility of the medication until the vial is out of doses to administer. So we're going to use dimensional analysis to calculate the volume that should be administered. The rough guidelines for the volumes are for subcut, an infant is under 0.1, a child under 0.5, an adult is 0.5 to 1 milliliter. So no matter what, subcut, general, like a rough guideline for that, will be under 1 milliliter. So you use that syringe. Intermuscularly, for an infant would be under 1 milliliter, a child would be under 2 milliliters, an adult would be under 3 milliliters. So that's why we use the 3 milliliter syringe. Now, I just told you this, but in some of my examples, an intramuscular medication may have 4 or 4.5 milliliters in it. There will be some extreme cases where you will get more than those. They're rough guidelines. So with the calculations, we're going to use dose times strength. So, for example, this first one says the prescriber orders sandostatin. I can't pronounce the name of that. 50 micrograms subcut every 8 hours. Read the label and determine how many milliliters of this hormone suppression you would administer. So the first thing I would look at is, one, it says subcut, so maybe it should be under 100 milliliters. The second thing I would look at is the dose times the strength. So the dose of this medication that you're going to give is 50 micrograms. And I need to know how much to administer, so I'm going to put micrograms down here. Look for the strength, and the strength is 100 micrograms per milliliter. So then I can tell now that my dose to administer would be 0.5 milliliters. 0.5 milliliters. Right. Moving on to the next example, it says the prescriber ordered Cleocin, which is that, 600 milligrams intramuscularly every 12 hours. Read the label and calculate how many milliliters of this antibiotic you would administer. So whenever I think of I'm administering, I think dose times strength, because I'm only going to administer one dose at a time. And the dose would be 600 milligrams. Times my strength with milligrams on the bottom. If I look at my label, I could either use 900 milligrams for 6 milliliters or 150 milligrams for 6 milliliters. It doesn't matter which one you use, but I'm going to use the 150 milligrams per milliliter. And if you do the math on it, it would be 600 times 1 divided by 150, and you would get 4 milliliters. 4 milliliters is a little high for intramuscular, but we're going to be okay with it. If it was 4 milliliters and it was subcut, you really want to check your calculations. All right, the prescriber ordered heparidol, 3 milligrams intramuscularly every 4 hours as needed. Read the label and determine how many milliliters of this antipsychotic drug you will prepare. Indicate the dose range on the syringe provided. So here we're going to say that the dose then would be 3 milligrams every 4 hours. So 3 milligrams is my dose times my strength with milligrams on the bottom, and my strength is right here at 50 milligrams per milliliter. So I'm going to say 50 milligrams per milliliter. Once that's canceled, when I say 50 divided by, 3 divided by 50, my dose would be 0.06 milliliters. 0.06 wouldn't go all the way here because that's 0.6, that's 6/10 versus 600. So it would be here. All right. The prescriber order is tobramycin, 120 milligrams intramuscularly every 8 hours. Draw peak and trough levels after the second dose. Notify the doctor if it's above 2 micrograms per milliliter. Read the label and calculate how many milliliters of this amnioglykoside you will administer. Okay, so you want to still do dose times strength. So it gives you a lot of information, but you're still administering it. So you're going to go dose, which is 120 milligrams every 8 hours. Times my strength, and my strength is here. And I can use that, however, that's milligrams. So I would rather use the thing under it that they gave me, which is 40 milligrams per milliliter. When I cancel that out, I get 3 milliliters. And that is my answer. Now you might be saying, but what does that 2 micrograms per milliliter mean then? The 2 micrograms per milliliter would be so you're giving medication and then you're monitoring your patient. And if your patient's test that you give them comes out above that, then that means that something went a little bit differently than expected, and you'll have to notify the doctor because it's not working the right way. Maybe it didn't go down enough, or I don't know, anything could happen. So you have to notify the doctor. So this is information that you need for the order. However, you don't need it for the calculations at this time. Okay, let's talk about parenteral medication supplied in powdered form. They are more injectable drug forms. So if it comes in a powder form, obviously we can't inject it, right? So we have to mix it with sterile solution to reconstitute it. Reconstitution just means you're changing it from one form to another. So I'm changing it from this, I have this pure drug that is in powdered form, and I need to shake it up with some sterile water to make it into a liquid form so that I can put it into a syringe so that I can inject it into my patient. So I'm wondering, why would this drug come in this form? So the drug would come into this form because it's more fresh this way. So I don't know if you might have a baby, then if you have to mix up baby formula, you're just going to mix up the formula right before you give it to your baby, because you can't just, have a bunch of bottles in the fridge that you already reconstituted, because the milk in it goes bad, and the formula, the powdered formula, is more of a it's the purest form of the drug. So whenever you have this kind of drug, make sure you check the expiration date on the drug itself, the active ingredient, that powder, and also on the diluting agents that you're using. And a lot of times after you administer it, then you'll have to check to see how much time the expiration. It could expire in an hour, it could expire in a week. and whatnot. So parenteral medications supplied in powdered form. To reconstitute a powdered medication, we're going to follow the directions on the label and follow the directions on the label, check the expiration dates of the drug and the diluent. We're going to add the diluent to the vial, shake, roll, or invert the vial as directed, and make sure the powder is fully dissolved. If you think about it, it has to be fully dissolved because you can't have clumps go up into syringes. It's like if you make a protein shake, you want to make sure all that mixture is dissolved in with the liquid before you drink it. So the order here, the first example is, the order is uniacin, which is ampicillin sodium sublactam sodium. Oh, it looks like a combination drug. You need 1,700 milligrams intermuscularly every 6 hours. We're going to read the drug label and portion of package insert and calculate how much we would administer to a patient. The package insert indicates that the solution must be used within 1 hour of preparation. We're going to recall that the strength is a fraction, which with pure drug on top and total solution on the bottom. So there are 2 ways to find the strength. Both will work for this problem. We're going to do dose times strength in order to find out how much to administer. Every time you see how much would you administer, you're thinking dose times strength. The dose is 1,700 milligrams. And we're going to times it by the strength. The strength, I hope it's in milligrams because I want to find out what it is. And there are actually 2 ways you can find this out on this whole thing here, which I'm going to give you a couple minutes to read to see if you can find the strength of that. I'll pull it up a little bit for you. Pause the video, read it, see if you can come up with the strength, and then come back. Oh, I guess I should leave it out for a second. Okay. All right, so if you found it, great. If you're still looking, that's okay. I just want to show you how to find it when you see labels such as this one. When I see labels like this, I'm going to say, all right, there's 1 of 2 ways I can find it. If I read the words, then it says here, the volumes will be added to obtain solutions containing 375 milligrams per milliliter. So there is my 375 milligrams per milliliter strength. When I cancel that and do the math, I get 4.5 milliliters. But again, I said there are 2 ways, right? That's the first way, because that was the easiest one for me, 1,700 milligrams times, and I need milligrams down here. I need a strength. The strength of the drug would be the amount of pure drug, so strength is the amount of pure drug for total volume. Or sometimes we say total solution. The amount of pure drug in this vial is 3 grams. So I'm going to base it on my information here. So this is the 3 gram vial, so it's 3 grams of pure drug over my total volume. So what happens is there's 3 grams and there's my total volume now, but volume is going to have this liquid. So when I add 6.4 milliliters of the diluent, then it obtains 8 milliliters of my withdrawal volume or total volume. So it would be for every 8 milliliters. Now, are you wondering why wouldn't you use this 6.4 versus this 8? And how come if you only add 6.4 milliliters of water, will I get more solution out of it? And this is what I can tell you. If you've ever made Jell-O, then you put the powder substance in and you add 1 cup to your measuring cup. And if you notice, after you add 1 cup of hot water, you get a little bit more than a cup. Because that Jell-O that was in the bottom of the container has now diluted a little bit with the water, and it's made it a little bit more volume. It's like when you have coffee and you add sugar to it, your coffee raises by just a little bit. So because of the amount of sugar that you put in it. So therefore, when you dilute medicine with like 6.4 milliliters of water, you're going to get 8 milliliters of a total withdrawal, just a little bit more to withdraw. But that makes your solution total volume 8 milliliters. So you can also use this for this. However, you have to get this 3 grams into milligrams. And the grams to milligrams, you know that for every 1 gram there are 1,000 milligrams. So there are 3,000 milligrams for every 8 milliliters of pure drug, for every 8 milliliters of water, a solution, sorry. So you have 3,000 milligrams for every 8 milliliter solution, and if you do the math on this, you'll also come out with 4.5 milliliters. So it doesn't matter where you found the strength in that label. The point is you have to find that strength somewhere in the label to do your calculations. Whew, that was a lot, huh? But remember, dose times strength. We found the dose, got it. Found the strength, got it. Done. All right. The prescriber ordered this medication, 250 milligrams intramuscularly right away to treat a patient who has gonorrhea. Read the label and the directions for the reconstitution to determine how to prepare and administer this antibiotic. The directions for the use says intramuscular administration. Reconstitute this drug for injection powder with sterile water for injection, and then inject, it should say dilutant, into the vial and shake the vial thoroughly to form the solution. In order to do this, we have to do a couple things. I'm going to blow it up for us. Let's put this down here. Well, let's just move this down. Much better. Just made it a little bit more clear. So if you read this vial, then you see that it is 500 milligrams. Oops. 500 milligrams. So all I care about is the 500 milligram patch. It's the same label that goes on all of them. 500 milligrams is my dosage strength of that powder in there. If I add 1.8 milliliters of dilutant, I reconstitute it to this strength. If I add 1 milliliter of dilutant, I reconstitute it to this strength. So there are 2 different ways. You're always going to make it the strongest strength, and I'll show you why. If you added 1.8 milliliters of dilutant to the vial, you will yield a strength of 250 milligrams per milliliter. If that were the case, then how many milliliters would you administer? Well, your dose, if we look up at the original dose, is 250 milligrams. Times your strength with milligrams on the bottom. Your strength, if I add 1.8 milliliters, my strength yields 250 milligrams for 1 milliliter. Well, that was easy math. It would be 1 milliliter to inject. Perfectly acceptable. However, if I add 1 milliliter of dilutant to the vial, will yield a different strength. And let's see what happens there. So I still have the same dose. My patient still needs 250 milligrams. But my strength, now, if I dilute with 1 milliliter, it's going to be stronger. Right? Less water makes it stronger. If you have less water in coffee, it makes it stronger coffee. If you have less water in Kool-Aid, it makes it stronger Kool-Aid. So if you have less water in anything, it makes the contents in it a lot stronger. So that strength then would be 350 milligrams per milliliter. If I would do this calculation out, I would get 0.71 milliliters. Now, I had 2 choices of reconstitution. If I reconstituted it to make it a stronger strength, where there's 350 milligrams per milliliter versus 250 milligrams per milliliter, then I only need to give my patient 0.71 milliliters injected into their muscle. However, if I diluted it with a weaker version, so in other words, it's like I would have to drink less coffee to get the same effect, or I would have to drink more coffee to get the same effect. You're always going to pick the strongest strength, and you're always going to pick the least amount to be injected. just like capsules and pills and stuff. You wouldn't give somebody 5 pills when you can give them 1. Just like milliliters here, you wouldn't give them 1 milliliter when you can give them just 0.71 milliliters. So you always need to give your patient the least amount of fluid to be injected. Therefore, you'll reconstitute the medication using less dilutant to make the strength stronger. So, in here, we have, let's go to 26, bigger, a little bit bigger. You would have, no matter what the order calls for, if you're giving the medication that you have to reconstitute, and we're given the following options, which would you choose and why? No matter what your order called for, your strongest strength is what you would choose, because it's the strongest, and we would administer less. And that's our goal. So, an order requires 80 milligrams of a drug to be administered IM stat. The vial has the above strength, either 10 milligrams per milliliter, 20 milligrams per milliliter, or 40 milligrams per milliliter. We're going to determine the required volume to be administered. Recall, you want to administer the fewest amount of fluids via subcut or IM because it is painful. So we're going to do dose times strength. Our dose would be 80 milligrams. And the strength that we chose is 40 milligrams per milliliter. Because if we choose that, we're giving the fewest amount of milliliters to be injected. So here we would have 2 milliliters. Which makes sense. If you needed to give 80 milligrams and you gave 20 milligrams per milliliter, then you would be giving 4 milliliters. And that's double that. That would be painful. Likewise, if you needed 80 milligrams and you used 10 milligrams per milliliter, you diluted it very much, then you would have to be giving 8 milliliters of intramuscular drugs instead of 2. So always think about picking the strongest strength, and you're always doing dose times strength. You're given a lot of information like how much dilutant to add, doesn't matter. You don't care. You care about the strength in the end after reconstitution. So all that matters for what you have to mix, but it does not matter when you're doing your dosage calculations after you mix it. So here's another example. A prescriber offered this medicine. It's a penicillin potassium, 200,000 units intramuscularly stat, so right away and every 6 hours. Read the label and calculate how many milliliters of this penicillin antibiotic you would administer to the patient. So if I'm administering it, it's just right now. And I'm administering and I need 200,000 units. When I have 200,000 units, then I have to, let me put this down a little bit. Much better. So I have 200,000 units as my dose, and I have to multiply it by my strength, which I don't know yet because I haven't reconstituted it yet. But I know I have units here. So if I look at my strength, it says the units per milliliter could either be 250 units per milliliter, 500,000 units per milliliter, or 1 million units per milliliter. And if I'm giving my strongest strength, I have 100 or 1 million units per milliliter. So again, this does not matter. This is just how much dilutant to add to get to this strength. So I want to pick the less amount of liquid to add because I want the highest strength, right? If you wanted coffee and you got a shot of espresso instead, that's good, but you had to drink less. Fewer calories, hey. Your units would then cancel out, and your answer would be then in milliliters, and you would give 0.2 tenths of a milliliter to your patient. Go ahead and try this next one, example 914. The prescriber ordered heparin, 4,000 units, subcut every 12 hours. Read the label and calculate the number of milliliters you would administer to the patient, then indicate the dose on the syringe provided. Okay. Go ahead and do that. And then check back and see if you got the same answer I did. So since I'm doing dose times strength, the dose is 4,000 units. And if I want to know what my strength is, it says right here, 10,000 units per milliliter. And then it also let me know that there is a 1 milliliter, it's a single dose vial, so you would only use it once. When you cancel out, you would be left with 0.4 milliliters. And if you're going to go ahead and put that on the syringe, it would be 0.4 milliliters would be right there. Okay. All right, the prescriber ordered this medicine, 200 milligrams intramuscularly every 6 hours. Read the label and determine how many milliliters of this you would administer. So again, we're doing dose times strength. You're going to get the dose, and the dose was given as 200 milligrams times my strength, which would be milligrams in the bottom. And then I look at my vial and I say, oh cool, there's 500 milligrams, but for what? For 4 milliliters. 500 milligrams for 4 milliliters. If you do the math, then you do 200 times 4 divided by 5, and you would get 1.6 milliliters. Go ahead and try 913. Pause it, work on it, come back. The prescriber ordered heparin, 4,000 units, subcut every 12 hours. Read the label and calculate the number of milliliters you would administer to the patient and indicate the dose on the syringe provided. So this person needs 4,000 units as their dose. If I look at my label, it says 5,000 USP per milliliter. Be careful, it does say it's a 10 milliliter multi-dose vial, but each milliliter has only 5,000 units per milliliter. It's not per 10 milliliters, it's per 1 milliliter. When my units canceled and I did my math, I would need to administer 0.8 milliliters. And then indicated on the syringe, 0.8 milliliters. Oh, done. All right, that's it. I hope this helped. Remember, there's a lot of information with that diluent as the added factors. But all you care about is when you're administering a drug, it's dose times strength. If you can find the dose and you can find the strength, you're done. Cancel your units. Always cancel your units. I don't know why I didn't cancel my units here. Let's do it now. That's right, because then I know for sure it ends in milliliters. All right. Good luck.